Hello everyone, this is Dr. Ketki Chajjed. I am a consulting homeopath practicing in Pune. I have done my masters in homeopathic materia medica, that is homeopathic medicines. I am practicing in Chajjed Clinic, Gultekri, Pune. Now let me come to the topic. In today's video, I would be talking and discussing about the current issue, coronavirus, which has rocked the entire world. Now what I mean to say is, everybody has gathered some or the other informations from here and there, mouth publicity, loads of information is available on the internet too. But this information keeps us confused with the lack of focus. Now what is coronavirus? Let me clear that first. Coronaviruses are a large family of viruses that existed on Earth since centuries. This is the primitive life form on the Earth. The only thing is that our human immune system has come into terms with this for the first time. Coronaviruses are viruses which are known to cause a wide range of respiratory tract infections, ranging from common cold to very severe illnesses. In humans like us, it has been known to cause respiratory syndromes such as SARS, wherein there is difficulty in breathing and then it calls for an emergency. Now, as you all know the basic symptoms of coronavirus, I would just like to focus on few things, such as the basic symptoms are fever, cold and cough, cough with breathlessness causing tiredness. There is also nasal congestion, cough with difficulty in breathing, which alarms to immediate medical attention. Along with this, there are pains, aches and diarrheas too. Now the onset is from mild to moderate, but in kids, in youngsters below teenage, the severity of symptoms varies. It is mostly mild to moderate only. Now the reason behind this I would like to clear. In kids below teens, there is a specific pigment which is yet to develop. That protein pigment is required by the coronaviruses to get attached to your cells. As these kids still have to develop that pigment, the illness, the symptoms is very mild to moderate. As and when you grow from teens to adolescents, to adults, to geriatrics, that is the old age group, the pigment has developed very well. So the severity changes from moderate to severity. Now let me come to the point. Why do people of old age, high in age group, develop this severity of illness? The reason behind this is there is a medical problem underlying, such as hypertension, any cardiovascular disease, that is any heart related diseases, diabetes. These are the conditions, medical conditions, which worsen the illness. And if you see over this range of age group, there is a lot many chances of developing such illnesses post 40 and 50 because of our lifestyle. Now, after telling you all this, I would also like to specify that there is 1 out of 6 patients who develop these severe symptoms. Many of them do get infected but have just no symptoms and no feeling of unwell, wherein some recover without needing any severe medical attention. Few, as and when, develop difficulty in breathing, cold, cough, fever, would be advised to seek immediate medical attention. Let's talk about the spread of this illness. The spread occurs through air. When an infected person sneezes or coughs, he coughs out or sneezes out the droplets of the virus. The droplets containing virus either fall on the surface or on the objects around that infected person. Any other person who comes in contact with those contaminated objects and then touches those hands on his face, mouth, eyes, nose, have higher chances of getting infected. The spread of coronavirus occurs in this fashion only. So it is very, very important for us to take care of these basic needs so that we can avoid the infection of coronavirus. Now let me come to the prevention part of it. Stay home. Being at home is very, very important. As we all know, the spread of coronavirus happens through air and touch. The moment you restrict yourself at home, you can easily avoid getting in contact with any infected person. That is the only basic and the most safest measure to prevent coronavirus spread in our community. Being a responsible citizen of our country, it is our first and the most primitive measure to be taken by us to avoid a community spread. Next, the spread of coronavirus is occurring mostly through touch of contaminated objects. So please avoid touching your hands to your eyes, face, nose, mouth, so that you can prevent yourself from getting infected. Next step is maintain at least a 1 meter distance from a person who is coughing or sneezing. You may not know who is infected around you, but this is something basic which everyone can follow. The most important step, you see to it that yourself and people around you are following respiratory hygiene. What is respiratory hygiene? Cover your mouth when you're coughing or sneezing with a tissue paper. Dispose that tissue paper immediately. This basic hygiene process would help you get rid of chances of getting infected. Now, what few lifestyle changes that can be done? Let me talk about yoga. There are many poses for kids. The cow pose, the tree pose, the reach out to the sun pose, the animal poses. All these poses would help kids to develop immunity, make them stronger, make their respiratory system stronger. Yoga has been known to give us immense benefits since centuries. And by naming these small asanas, reach out to the sun, cow pose, kids would love to get engaged in these asanas. So we should be taking this as a first and basic step towards prevention. Next comes for us also, as well as kids, that's Anulom Vilom, Pranayam, Surya Namaskar, meditation, Om chanting. These are the basic things that we should follow and see to it that our kids at home also do them. After this, I would come to some dietary changes that can be easily followed by all of us. We need to increase the intake of vitamin C by having a good portion of yellow and green fruits and vegetables like lemons, oranges, mangoes, green leafy vegetables, etc. 30 minutes exercise every day. Including this 30 minutes exercise regime in our body, in our day-to-day life, would help us fight the infection, would give us the strength and develop immunity towards these infections. Then comes intake of protein. We need to increase the intake of proteins by having curds, nuts, legumes, sprouts compulsorily every day. We should also see to it that we take vitamin C supplementation, B complex, as well as vitamin D supplementation to avoid and to develop immunity towards this infection. Now I would talk to you regarding the treatment, which is the most important part of the entire video. The treatment for coronavirus is only symptomatic. in conventional medicine, there is no precise medicine for the treatment of coronavirus. Conventional medicine lies on the diagnosis. Looking onto this, the treatment line depends on the diagnosis. Such as if the patient is suffering from flu, the line of treatment would be different from that of a patient suffering with a bacterial infection. The conventional medicine is still in research to find a drug to cure coronavirus. Research is also going on to see the response of patients to be treated with hydroxychloroquine. Now, plasma therapy is also in, but the results are yet to be seen. Now, the government has also been in process of passing a bill to advocate homeopathic drugs in the treatment of coronavirus. But yet, the bill is to be passed. Historically, let me talk to you, in the 18th century, homeopathy has proved itself to be one of the most challenging medicine to cure cholera epidemic in London. The government itself had approved homeopathy then in 18th century, and homeopathic medicines have cured more than 2 lakh patients in London. Homeopathic medicines work symptomatically. As and when the patient complains of cold and cough, which is a very acute onset, which is the basic primary symptom of this illness, homeopathic medicines can be advocated to these patients. Homeopathy is known to abort the course of the illness. That means it has the ability to stop and reduce the longer course and make it shorter. As well, it is also known to reduce the complications and sufferings of the patients. Homeopathic medicines do not rely on diagnosis, and this is the very important thing which can actually help us cure the illness and abort the illness at an early stage. As we all know, the tests being conducted today give us results, and the results of the test tomorrow. But if the right homeopathic medicine is advocated at this point, at the onset of symptoms, when the patient has basic cold, cough and sore throat, we can reduce the course of illness as well as reduce the number of patients with complications. We do not need to wait for the results of the tests that are being conducted for the patients. Homeopathy is very well known to abort the illness. Many patients would not further land up into complications. Now, what I would like to tell you in the end of this video is stay home, stay safe, see to it you eat right, you stay fit, you exercise, and please take care of the basic preventions to be taken so that we do not land up into these major illnesses. Yes, but once you develop any kind of cold, cough, fever, anything that's alarming, please seek medical attention immediately. Thank you.